Hi, I'm a rheumatologist, and we have to talk about this post, especially these comments, because wow, there's a lot of misinformation going on here. Listen, it's totally normal to be nervous about new medications and dose changes. That's human. But some of the responses this person is getting are incorrect, and some of them are just plain dangerous. I always tell my patients I will support your informed decision, but informed means understanding the evidence base and not just believing whatever the internet is shouting at you. First of all, we don't know what these medications are being used for. Methotrexate and prednisone are used for a lot of different conditions. The right choice of medication depends on the diagnosis, the organs involved, and the labs. It's not one size fits all. Here's the real deal. Having an autoimmune disease is like having a fire burning inside your body, and our medications are designed to put out that fire before it causes structural damage. Because once it has caused damage, like in a joint, for example, we cannot reverse that damage. In the old days, all we had to treat autoimmune diseases were steroids, like prednisone. And yes, they work fast, like putting water directly on a fire, but they mess with your hormones in the long term and have a lot of potential side effects if you're on them long term at a high enough dose. That's why medications like methotrexate and the biologics were invented, in an effort to get people off long-term steroids because they have less long-term risk than chronic steroid use. While steroids work fast, like putting water on a fire, the medications like methotrexate work more like slowly turning down the gas. So you will see an effect, but it takes time to take effect. Sometimes we use a short course of steroids to calm things down quickly while we are waiting for that long-term medication to take effect. So please be careful getting medical advice online. Talk to your doctor if you have any concerns about your medication.